what I'm concerned about is, just say if my husband got laid off.
Right.
Say we had no health
You had no health
care
insurance.
insurance. Okay.
Now, right now, before reform, if you had no health insurance, you'd just be out of luck.
All right.
Okay.
And then we'd get the government-run health insurance, right?
Well, no.
Is that what you're saying?
Here's the way it would work. So let me just kind of map it out for you. If you are already getting health insurance on your job, then that doesn't change. Health insurance reform was passed 6 months ago. I don't know if anybody here has gotten a letter from their employer saying you now have to go into government-run health care because we can't provide you health insurance anymore. I mean, that hasn't happened, right? So you're keeping the health insurance that you had through your job, and the majority of people still get health insurance through your job. The only changes we made on people's health insurance who already have it was to make it a little more secure by saying there's certain things insurance companies can't do, a patient's bill of rights, basically. So insurance companies can no longer drop your coverage when you get sick, which was happening. Sometimes there were some insurance companies who were going through your policy when you got sick to see if you had filled out the form wrong, you hadn't listed some infection that they might call a pre-existing condition, etc., a bunch of fine print that led to people not having health insurance. So that was one thing that we said. We said also you can keep kids on your health insurance till they're 26. That children with pre-existing conditions had to be covered under health insurance. So there were a handful of things that we said insurance companies have to do, just as good business practices to protect consumers. But otherwise, you can stay on your employer's health care. So that's if you have health insurance. The other thing we did was we said a lot of people who don't have health insurance is because they work for small businesses who have trouble affording health insurance because they're not part of a big pool. They're not like a big company that has thousands of employees and they can negotiate because the insurance companies really wants their business. So what we said was, let's provide tax breaks to small businesses so they're more likely to buy health insurance for their employees. And right now, about 4 million businesses across the country are now getting a tax break, a tax credit if they provide health insurance for their employees that can save them tens of thousands of dollars. So that's the second thing. And the third thing we said was, okay, if you don't have health insurance, I'd say just say your job doesn't offer you health insurance or you lose your job. Then what we're going to set up is what's called an exchange, which is basically a big pool. You become part of this big group of people, just like as if you were working for a big company or a big university like Drake. You become part of this pool, and you'll be able to buy your own insurance through this pool, but the rates will be lower and you'll get a better deal because you've got the bargaining power of these thousands or millions of people who you're buying it with. You'll still have a choice of plans. You'll have a choice of Blue Cross, or you'll have a choice of this plan or that plan, but you'll be buying it through a pool. And if you can't afford it, then we'll provide you some subsidies to see if we can help you buy it, so make it affordable. So that's essentially what health reform's about. Now, what that means is that you're not going to be forced to buy a, quote, government-run health care plan. The only thing that we have said is that if you can afford to get health care and you're not getting health care, well, that's a problem because that means when you get sick and you have to go to the emergency room, everybody else here has to pay for it. And that's not fair. So we've said if you can afford to get health care, we're going to make sure that you can afford it, but you've got to have some basic coverage so that we're not subsidizing. Everybody else isn't paying an extra $1,000 on their premiums to cover you.